Tom Hirschlein. I'm a professor of medicine here at Wright State University, and I've been going on the trip to Jamaica every summer. I think this year was the 8th year. My favorite aspect of this trip to Jamaica is seeing the way that the students come together as a team. At the beginning of the time, they're mostly unsure of themselves and what they're supposed to be doing and how things are going to go. And by the end, they pretty much feel like they could be doing this trip on their own in terms of just knowing how everything works. They know the common problems, what we're going to do for most of the people that we're seeing there before they come and staff patients. So I think the Jamaica trip is good from the students' perspective for a number of reasons. One is that they speak English. Another is that it's a fairly short flight to get there, and the logistics of travel are relatively simple. And I think most importantly, we have a long-term relationship working with American Caribbean Experience. So we're going to, for the most part, the same communities every time that we go. They know us. We have seen a lot of them through the years, and I think that makes for a good experience for the students.
I'm Stephen Cooper. I am a class of 2017, so I'm a second-year medical student, and I went on the Jamaica trip summer of 2014. I don't think you could go on one of these trips without probably gaining a significant amount of clinical experience. But the Jamaica trip was unique in the sense that it had the volunteering aspect, it had the clinical experience aspect. You practice all the skills that you worked on all through first year, as well as learning plenty of new ones. And the single most unique and important thing about the Jamaica trip is the relationship that the organization has with the surrounding community.
Yeah, going forward, it's clear that number one, that we're going to more and more places, and the ACE, American Caribbean Experience, partners with the Ministry of Health for the area, for the parish, which is St. Mary Parish, and goes to those areas that are the most needy. And there are unfortunately a lot of communities in great need. So we'll continue to expand the places that we go to. And the other thing that I foresee in the near future is implementing an electronic medical record so that we can have a better continuity of care.
I'd say the best thing about the Jamaica trip are our leaders that go with us. Stephen Guy and Dr. Thomas Hirschlein are awesome. They were by far the biggest and most helpful aspect of the trip. I think if you ask all 10 of us that went, every single person would have nothing but positive things to say about them. Really, it benefited us as students to be in that environment.